Our final speaker is a faculty person here at Regis College. Mary Ann Hart is the Assistant Clinical Professor of Nursing at Regis. And most recently, she's taken on a new program we have. She's the program director of a newly created Master's in Health Administration. And we are very excited about that program. We did a needs assessment and found out how many people that already have clinical degrees might also want to learn more about health administration. And you just heard from Melissa the complexities of these high-risk pools and the thises and the that's, and the amount of system change that's going to have to take place before we can get the payoff that we need to do payment reform and to get everybody adequately covered. They're going to have to know an awful lot about health administration. So we're very excited about that. And Mary Ann has been terrific at leading us in the whole public policy debate. So Mary Ann Hart.
Thank you. What a great turnout. Something going on here? I am going to be talking about healthcare providers. And how many of you here consider yourself healthcare providers? Okay. How many people are healthcare providers that are nurses? Okay, just what I thought. I'm going to be talking about healthcare providers in general, but really with a focus on nursing, because I know that's what people are interested in this crowd anyway. So here's my little graphic here. Maybe you've seen this before. And I think this really describes what happens when people sit down together and start talking about health reform. We all start talking about how important it is to cover everyone and improve access. But in the backs of everyone's mind, people are wondering about money. And that's particularly true of healthcare providers because nobody wants to give up money, correct? No one wants to make less money. People usually want to make more money. So money is in the back of the minds of most healthcare providers. Who are these providers? Well, this is just a sample. Healthcare institutions are providers like hospitals, home care agencies, community health centers, clinics, and of course, health professionals are providers. Nurses, physicians, pharmacists, healthcare administrators, and there are many, many others in our system. Just want to talk a little bit about healthcare institutions. So this is just a sample of the trade associations that represent different healthcare institutions. The Hospital Association represents hospitals. The Catholic Health Association was in the news recently. That's an association of all of the healthcare institutions that are related to Catholic organizations, or they are actually Catholic-run institutions. Like Caritas, for example, in Massachusetts. And then you can read some of these other interest groups here. So out of that crowd, who do you think might be for health reform? Interest groups always have, public policy statements and usually do take positions. Or should I say, is there anybody in that group that might not be for health reform or might not be as enthusiastic about health reform? Any volunteers? Okay. So in general, this group of trade associations support health reform, but the long-term care organizations, which are the American Healthcare Association represents skilled nursing facilities, and American Home Care and Hospice and the Visiting Nurse Associations all have one time or another said that they're for national health reform, but they have been less enthusiastic than the top three groups listed here, and I'll talk about that in a minute and why that is. Health professionals. Okay, so here are the professional associations representing health professionals. The American Nurses Association, the Colleges of Nursing, the American Medical Society, the Pharmacy Association, Dental Association, Healthcare Executives. All of these groups have come out very strongly for national health reform with one exception. Anybody want to volunteer who that might be?
No, AMA's for it.
AMA is for it.
Yep.
They were
Society
not
Special-
for Medicare and Medicaid, but they are strongly for health reform. They have some issues that they're a little disappointed about. They weren't able to get in the bill. But it's actually the Dental Association. The Dental Association is very disappointed that there isn't a dental benefit that is being mandated through national health reform. All the others have come down in favor. And no one is more enthusiastic than the Mass Nurses Association. Okay? So nursing has a very, very long history supporting universal coverage. Everybody here know the great nursing theorist Peplau? In 1974, she wrote that healthcare is a right. In one of her most important articles, she basically says the right to healthcare is the implementation of the Bill of Rights. Okay? You can read the rest. 1974. The ANA Code of Ethics, the very last section of the Code of Ethics has a paragraph on social reform, and you can read it. But basically what they say is we have to look beyond institutional issues, and we have to look at society as a whole and think about health and how important it is to deliver health to people. So it's no surprise that the ANA has made very, very strong statements on health reform. Here's one of them. But if you go to their website, which is incredible, there's a health reform toolkit, and they have links to many, many sources in and out of nursing. And when I was researching, getting prepared for this talk, I decided I wasn't just going to be looking at websites and writing off of what I already know, that I was actually going to call around and see what people had to say. So when I talked to the nice young man, he sounded like a young man, government relations person at the ANA, he basically used the word jubilant to describe how the ANA felt about the health bill. And you'll see why we'll talk about it. He said, we didn't get everything, but we got 90% of what we wanted. So here's a strong statement of health reform. Nursing's been there from the beginning. Now I'm going to switch back. We'll get back to nursing. What are the provider issues in health reform? Financial stability, health systems improvements, and healthcare workforce development. These are some of the provider-related issues. Financial stability, 94% of Americans are going to be insured if, in fact, the National Health Reform Law is implemented as it has been passed. And interestingly, a couple days ago, stocks rose on the stock market after health reform passed, okay? And particularly in the area of hospitals and pharmaceutical companies. And that's because there's going to be a lot of new business for health providers. They're going to have more patients who are insured, 32 million more people with insurance. So in fact, it's actually going to be very, very good business for the health sector. There's going to be a reduction in their uncompensated debt, and certainly hospitals have been providing care for people without insurance. It may not be the best care, or it may be scattershot care, but they have been providing care. Physicians also estimate that they've been providing a lot of uncompensated care. And financial stability also has to do with payment, and there's an increase in payments if you're doing primary care through Medicare and Medicaid. The other thing, the article that I read in terms of where the stock market might be at, is that there will be more certainty in relation to the rules that govern the industry. Health system improvements, if you look at what providers have to say, institutions and professionals, what they like one of the things they like very much in the bill is that it reduces the bureaucracy by standardizing paperwork. There are investments there related to evidence-based research, related to patient outcomes. There are investments in relation to managed chronic disease management programs and medical homes. We heard about what we're doing in Massachusetts. Again, people are wanting to do more on the federal level and help states do that. And also, the bill involves providers in terms of establishing standards of quality. These are things providers like. The healthcare workforce, very important piece, and we're very interested in this, of course, in nursing. The National Health Service Corps is expanded, and with a direction towards getting primary care practitioners, more of them in underserved areas, and certainly nurse practitioners are part of that group. Increases low-interest loans, scholarships, loan repayment programs to increase the supplies of certain health providers. And there's also money that's going to go to institutions and to states for basically their incentives for faculty to teach in some of these areas, and especially in nursing. The bill creates an advisory committee to develop recommendations long-term to look at the country's workforce needs and help states doing that as well at a state level. So let me just talk a little bit about primary care. How many people are in the nurse practitioner tract here? Oh, wow. Okay. All right, good. I knew you'd all be here, so I put this slide in. I mentioned before about the increase in reimbursement for primary care. One of the things that happened in Massachusetts when we suddenly had 400, not suddenly, but over a period of time, had 400,000 new people insured, is that we very quickly realized that we didn't have enough primary care providers. And people who hadn't seen a physician or a nurse practitioner in a while were waiting maybe 4 or 5 months or longer to get an initial appointment. So in anticipation that the same thing would happen on a national level, and in fact, we probably in most states have primary care provider shortages already, but they're going to get worse. When you insure an additional 32 million more people, you're going to have a real demand for primary care. So to get more people to go into primary care, the reimbursement rate under the government programs is being increased. The preventative services is being encouraged by also increasing payments for preventive services. And again, I mentioned education incentives for people going into primary care. And there's really a big chunk of change that's going to go to community health centers. And community health centers are really key in underserved areas. And community health centers use nurse practitioners a lot. So it's important expansion. Again, the National Health Service Corps. The other thing, there's an interesting section in the bill having to do with the expansion of nurse-managed clinics, okay? They are usually affiliated with an institution or an institution of higher learning, a college or a university. And the idea is to get more nurse-managed clinics that can manage care, particularly in underserved areas. School-based health centers, that's something that we at Regis have experience with, and money for school-based health centers in underserved areas. Okay, well, you know how you always hear that we're going to expand the number of primary care docs, and if you're a nurse, that drives you crazy, right? Because you're saying, of course, well, you know, you can expand primary care docs, but what about nurse practitioners? Well, a lot of the language around national health reform, you hear that primary care docs, but in fact, if you look at the bill, there is provider-neutral language. It's primary care provider. So this is one of the big wins that nursing got. So in all the incentives around primary care, nurse practitioners are part of that, and in some cases, certified nurse midwives. I've just listed a couple of programs where that are set up through the health bill that are really going to use nurse practitioner models. This